Alright, so we've been dispatched to a 70-year-old male who has collapsed on a sidewalk. Approaching the scene, it looks safe, there is no immediate danger. There are bystanders but do not look like a threat. We are wearing our correct PPE gear. There is good access in and out of the scene. We also have easy access to the ambulance. Do you feel safe?
Yes.
I do too. Yeah.
Hello, sir. Sir, can you hear me, sir? Open your eyes. So it's not reacting to the pain.
So I'm going to check his airway if anything's obstructing it. It's not, so I'm going to check his breathing. Feel, look and listen for 10 seconds. Looking for chest rise, listening for breathing. So he's not breathing. You can start compression, Alright. AUT 1 to comms.
Go ahead.
R49 requesting R50.
Copy.
Alright, I'm going to set up the defib while compressions are going on. Attach the pads around you. Okay.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button. Shock delivered. Pause. Start CPR.
So I'm going to apply, I'm going to ventilate the patient now. I'm going to squeeze 1/3 of the bottle of the bag using the cigarette, watching for chest rise. Place a towel under his head. Easier access. Now I'm going to attach the oxygen.
9, 30.
I'm going to run the oxygen at 10 to 15 litres per minute. We don't want to cause any gastric inflation. Still watching for chest rises.
25, 26, 27, 28, 29, 30.
Alright. I'm now going to insert my OPA, measuring from the mouth to the jaw. I'm going to insert upside down, rotating 180 degrees. Being cautious of not
25,
causing
26, 27, 28, 29,
any soft
30.
tissue damage. I'm now also going to insert my NPA, measuring from the nose to the earlobe, inserting 90 degrees at a 90-degree angle. So that continue plenty of compression.
5, 6, 7, 28, 29, 30.
So in the next round we'll swap here. Some of the contraindications of the OPA is
5, 26, 27, 28, 29, 30.
nasal polyps and head trauma. Some complications can be bleeding.
5, 6, 27, 28, 29, 30.
Stop CPR. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. No shock advised. Pause.
Could you please stop? Count my
If needed, start CPR.
Alright, so contraindications for the OPA are instant gag reflex. Some of the complications can be
25, 26,
Split.
27, 28, 29, 30.
it can stimulate the vagal nerve and cause vomiting. So we're going to continue 100 to 120 compressions per minute, keeping the blood circulation going. About 2/3 of the chest.
5, 6, 7, 28, 29, 30.
Did anyone see what happened?
No.
No?
We just found him and he'd collapsed.
Do you know if he has any pre-existing medical conditions?
No, I don't, sorry.
Did anyone start compressions before we got here?
Oh, we'd been doing them for about 2 or 3 minutes, but you guys had showed up by then.
5, 26, 27, 28, 29, 30.
Still watching for chest rise. So now we're waiting for backup. Continuing compressions.
5, 26, 27, 28, 29, 30.
Watching for any signs of life. So backup has now arrived,
Stop CPR.
and we see signs of life.
Analyzing heart rhythm.
This is our first response pack. In this pocket here, we've got our stethoscope, our BGL kit, our adult and pediatric BP cuffs. We also have a thermometer, a pupil torch, and our shears. Here we have crepe and triangular bandages. We have two different two different size tapes. We've got tourniquets, we've got our combine dressings. We also have gauze squares and steri strips and our saline ampules. Here we have our emesis bags, our ethyl chloride spray, the spinal lanyards, and the N95 mask. In this pocket here we've got glucose satchels, we've got glucose solution, we have glucagon, we've got a syringe with a drawing up needle and a fluid giving kit. Up here we have our paracetamol, we've got our ibuprofen, our tramadol, methoxyfluorine, and our loratadine. In this pocket we've got our laryngoscope, forceps, we have different sized OPAs and MPAs, we've got the lubricant, as well as a biohazard bag. Here we have the nebulizer, we've got a adult and pediatric size mask, oxygen tubing. Here we've got adrenaline, salbutamol, and aprepium. Here's our slippery sound, sharps, we've got a litre of saline fluid here, a towel, we have our C-collar and our splints, we've got an IV roll, a LMA kit, as well as a adult and pediatric bag valve masks. These combine a ventilation bag with a filter. It also has recess masks as well as a reservoir bag and PEEP valves, as well as oxygen tubing. This is the suction unit. Before every shift we want to check that all these are tightly sealed. We want to give it a test as well by blocking off the suction itself. Holding the test button, pressure will rise all the way to the top and eventually will stop. Okay. We also want to check that it actually does work. Put my thumb over the hole at the top here. Check that it does work. So when we do use the suction, we'll put the patient in the recovery position. We will, when using it, we'll rotate as we go in, suctioning on the way out. We will not suction for more than 10 seconds. Some of the complications can be soft tissue damage we can cause, as well as induced vomiting, hypoxia, and we've got this rigid catheter here. There's also a a soft catheter that we can use when traveling. Oxygen bottle. In the truck, it would have a tag on it saying if it's in use, full or empty. We've got the regulator here. Gorge, the dial for the amount of oxygen we would like to use, and the clamp head. We want to check the Bodell seal, which is the rubber seal here. Check nothing's wrong with it, it's not damaged. I'm putting the regulator on. I want to make sure it matches, is in line perfectly. Tighten it, and then turn it on all the way. The gauge would go up, tell you how much is in the oxygen bottle, and then we'd turn the dial. When using nasal bottles, we'd put it on to about 2 to 5 liters per minute for patients who require little oxygen, assistant with breathing. Put those to the nose, these around the ears, can tighten it, loosen it with this here. When using the O2 bottle, we would have it laid down. There is also the bag valve mask here. This is for patients who require a bit more oxygen. Apply it using the C grip, about 10 to 12 liters 10 to 12 liters. Watching for chest rise, just like that. Turning it all the way off, letting the regulator bleed. The gauge would go all the way down, and then take it off. So here we have the LifePack 12. I'll be demonstrating the pre-operational checks before shift. So the first thing I'll do is check the battery packs at the back here. Press these 2 grey buttons. They both appear to be fully charged and they are ready for shift. So I will turn the monitor on using the green button at the top here. So the first thing I'm going to do is put it into manual mode, pressing advisory button here, select yes. I now want to perform a operational check, so I'll go down to options, select user test. While that is going on, I will explain what is in each compartment. So at the back, we've got the non-invasive blood pressure cuff. We have the defib pads and an extra roll for the printer. Here we have the CO2 monitor. We've got the SpO2 monitor, the 3-lead ECG, and the dots which will go on the left arm, the right arm, the left leg, and the right leg. In this compartment here, we've got the aspirin, the GTN, and a razor. We also have the 12-lead ECG and a test lead. Okay, so the operational test has said it has passed, so it's all good to use. And I want to do a defibrillation test. So I will choose the amount of joules we want to use. So I'll go all the way down to 50 for this test. Select that. I'll make sure that the test load is attached. I'll begin charging, using the charge button here. I'll wait for the noise and press shock. I'll now demonstrate how to disarm a charge. So I press the same button, charge, and then press this button here to disarm. If I want to increase the volume of the QRS wave, I will select this here, can increase or decrease the volume that we're after, and then press home screen when done. If I want to increase the QRS wave, the size of the QRS wave, I will press the size button here. I will press the desired size we're after. Go with 1.0 for now. To change the leads, I could go to, we'll select the 3 lead for now. The paper for the printer is held here when wanting to change it, and that's the LifePak top.